Okay, the topic is ulnar nerve. Ulnar nerve is also known as musician nerve or the nerve of fine movements because it is commonly injured in musicians due to fracture of medial epicondyle of humerus. So before discussing about the clinicals of ulnar nerve, we should have information about root values and course of ulnar nerve. Okay, so as you can see in figure, we have a C8 and T1 roots. These are the roots of brachial plugs. The medial cord of brachial plugs give rise to the C8 and T1 roots, and by the combination of C8 and T1 roots, we have ulnar nerve, or also known as a musician nerve. Okay. Now we will discuss about the course of ulnar nerve in three stages: at arm, forearm, and hand. We have discussed about the root values of the ulnar nerve. Now we will discuss about the course of ulnar nerve. So the ulnar nerve enters into the arm through axilla. It passes distally from axilla anterior to the insertion of teres major. Teres major is originated from the scapula, and its insertion on medial circles of the humerus. So it passes distally from the axilla anterior to the insertion of teres major and to the long head of triceps. That one is a long heads of triceps, and the ulnar nerve passes anterior to the long head of triceps medial to the brachial artery. So the brachial artery is also a companion of the ulnar nerve in its journey to the hand. Okay, so now the ulnar nerve pierces medial intermuscular septum with ulnar collateral artery. So that one is a medial intermuscular septum. So the ulnar nerve pierces it, and it descends between the septum and the medial head of the triceps. That one is a medial head of triceps. So the ulnar nerve descends between the intermuscular septum and the medial head of triceps. Now it passes posterior to the medial epicondyle. As you can see in pic, that one is a medial epicondyle. The ulnar nerve is passing behind the medial epicondyle to olecranon to enter the forearm. So it passes between the medial epicondyle and enters into the forearm. The medial epicondyle is a place where the ulnar nerve is compressed because of some reasons like continuous pressure of the ligament or some kind of inflammatory issues. We will discuss about it later. As you can see in pic, that one is the ulnar collateral ligament, the ligament of the elbow joint. So what will it do during elbow flexion? It causes the compression of ulnar nerve. In certain conditions, like if there is a fracture of medial epicondyle, then during flexion the ulnar collateral ligament will cause the compression of the ulnar nerve because of shortage of room. Now ulnar nerve enters forearm by passing between heads of flexor carpi ulnaris. So that one is a flexor carpi ulnaris, and that one is a flexor digitorum profundus. Okay, so the ulnar nerve enters forearm by passing between heads of flexor carpi ulnaris. It descends forearm between flexor carpi ulnaris. That one is a flexor carpi ulnaris muscle, and that one is a flexor digitorum profundus. So the ulnar nerve descends through the forearm between flexor carpi ulnaris and flexor digitorum profundus. It passes through the flexor retinaculum superficially. That one is a flexor retinaculum. So the ulnar nerve passes through the flexor retinaculum superficially. So after its course in forearm, ulnar nerve enters into the hand by entering into the ulnar tunnel are also known as a Guyon's canal or the ulnar tunnel. Okay, so at the ulnar tunnel, here we have a ulnar tunnel. That one is a ulnar tunnel. So in ulnar tunnel, the ulnar nerve is at the superficial end of the flexor retinaculum. Okay, so and it enters into the hand by passing between pisiform and hook of hamate. As you can see in pic, here we have a ulnar nerve. Okay, it enters into the hand between pisiform bone and hook of hamate. These are that is the pisiform and that is the hook of hamate. So it passes between the pisiform and hook of hamate, enters into the hand, and at that position it bifurcate into the superficial and deep branches. Okay, so as you can see in pic, the ulnar nerve now is bifurcating into the superficial and deep branches. Okay, so the superficial branches supplies the anterior surface of the medial 1.5 digit. The deep branches supplies hypothenar muscles medial to lumbricals, adductor pollicis, deep hand of flexor pollicis brevis, and all anterosseous.